Okay, so adoptive child disorder has a lot of these problems. It deals with attachment, behavioral problems, bonding, lying, stealing, defiance of authority, and violence. So, attachment, I would say, is probably one of the biggest issues that happens with adopting children because many times, the biggest forms of attachment happen in our very young and early stages of life. Uh, so, when these things are disturbed, many times this causes a lot of issues with attaching to anybody, especially new people who are supposed to step in as parents. Um, this is really difficult, especially, adopting an older kid, but it can even happen adopting an infant because there's a lot of prenatal things that happen. There can be, prenatal substance abuse, prenatal deprivation, and there's different reasons why children never learn to attach properly. The kind of behavioral problems can make life really, really difficult. Acting out, the stealing, the lying. It's a lot of different things because these children have been deeply traumatized by the things that they've gone through. They're definitely going to experience a lot of, bonding issues, maybe a little bit of lying to their parents. And then there's a whole other form that they're going to go through, which is lifelong issues of adoption, which is loss, rejection, guilt, shame, grief, identity, intimacy, and mastery and control. So when a child loses or, joins a new family, they also can feel as though they've lost their old family. When they join a new home, they may feel that they don't fit in. They may feel a lot of rejection from that, even if the family tries their very best. They might feel guilty that they've left their old family. They may feel guilty if they have siblings that were not able to be adopted, but they were. They might feel shame from other people in the world that were not adopted when they go to school and they work with other peers, They'll feel that. They'll go through the stages of grief because they really, truly, if their siblings are in foster care or, they're struggling in all different kinds of ways to deal with the fact that they have lost a piece of who they are, which also fits right into identity, that they don't know what to identify as, their birth family, their new family. And it's a struggle for many, many children going through adoption. And as much as it can be a great thing and they might be excited, they also still have these fears. And intimacy is a big one because it's hard to get intimate with anybody if they've been abused, if they've been traumatized. The people who are supposed to take care of them in the past had failed them. So they might find it hard to grow close and intimate with the new family. So for the micro level of social work dealing with adoption, there's options. They can work with counselors and family therapy to work on their relationships and strengthen them. Obviously, if you're adopting a child, you want to go through intensive therapy with the family. They may want the adopted child to do individual counseling and therapy to deal with their emotions, to deal with their grief, to deal with their struggles with their siblings, all that kind of stuff. You want them to work towards a healthy relationship with you, but also a healthy relationship with themselves. You want to work on creating strong bonds to make the family feel unified and together, make the child feel a part of that family, especially if there's other biological children in the home already. That can sometimes make adoption really difficult. And the family needs to recognize, adoption is significant to this child. Some people try to, hide adoption from their adopted children. Sometimes that can be really unhealthy because this is a significant portion of a child's life. So they kind of need to be a part of it. On the meso level. So adoptive families need support from their adoption care workers and agencies. They need to work with the family for smooth and effective transitions into adopted life. They also need to know about their community resources that are available and support groups to help the adoption. Adoptive parents should have a support group. Adopted children should have a support group, working with their peers of other adoptive parents, other adoptive children. Which leads into my next thing, allowing them to talk and sort through, because a lot of times adopted children are all kind of feeling the same, like grief and attachment and loss. For the macro level, to me, this is kind of a complicated area because I think that things that cause adoption issues stem from the traumatic experiences that children have before. So a lot of this comes from the intense amounts of trauma they've endured in their past, in their homes, in their biological lives. They go through the feelings and emotions because they have a lot of things that have happened and the trauma is really deep-seated. So the best thing to do is have prevention in biological families pretty early on. I know with a lot of the trauma-informed care that I've seen, it's really getting to the nitty-gritty of the pathology behind the things that have happened to children, but also really trying to work in inner cities and with at-risk families to prevent these kinds of trauma. Unfortunately, once adoptive parents get these children, the biological damage that has already been done can sometimes be really intense and really aggressive, no matter how invested and dedicated the family is. So it's really important to look at trauma and to look at different high-risk families and try to intervene as soon as possible. So as interventions that I found, a really great one that I liked was the child-focused recruitment with Wendy's Wonderful Kids. So this is a program that is centered for children to have a say in their adoptive family, to really meet families, have them matched by professionals who want to help them. Their goals are all foster care adoption recruiters practice child-focused recruitment. So that means it's more so what the child needs rather than this family needs. And obviously the needs have to go together. Children at risk of aging out of foster care, so as they're older, they try to find them a secure placement as soon as possible because they know that their options become much more limited once they age out. Next is significantly increase the adoptions of older youth and reduce the number of kids aging out. So instead of kids going all to independent living, they want them to go to homes, because even in independent living, I've seen, a lot of 18-year-olds who are on their own and live in their own homes, but can't really provide for themselves. And I can't even imagine myself at 18 being able to do that. So that strong sense of family and base is what's really important for Wendy's Wonderful Kids, rather than having children age out of the system and kind of fall through the cracks. The other one is Healing Hearts Camp. And this is to help families that have adopted children or that kids have reactive attachment disorder for whatever reason, and they want to build these bonds. So the camp is to fill parents with hope for the child's future, encourage parents not to give up, guide them to understand the effective interventions, and avoid harsh punishment and anger. Teach parents how to help children become respectful, build self-respect, and be responsible. Have peace and love and laughter in the home, and provide a permanency. So a lot of kids struggle with attachments because they've never had a permanent person in their lives, so that they're just trying to fill that need. So by, providing those kind of bases and teaching parents how to do that, the child might feel more comfortable and be able to attach easier. So in conclusion, adoptions can be a really great thing. However, there's so many pieces that need to be looked at. Children's best interest should always be what comes first. They need to prepare a new adoptive family for whatever they're going through. They need to be very open with families, which is, the thing I saw that kind of had a family fall apart because the agency was not open about what the adoption was. They need to make sure that they continue to support the family throughout the adoption. This would help prevent failed adoptions, disrupted adoptions where they, tell the agency, I've changed my mind. And they need to go through all the guidelines. Is this open? Is this closed? Have very firm, significant things that the families need to sign and be a part of. There needs to be counseling services in place. There needs to be a lot of help with bonds and attachment. They need to work really strongly on that. They need to educate parents foremost before they adopt the child. These parents need to be ready for whatever, is coming, but they need to be prepared the best that they can. There needs to be investment from the families that are willing to adopt, and they need to be fully ready for whatever comes with adoption. And there also needs to be taking into consideration the biological family, if they're a safe family, if it's, healthy for the child to still have attachments to them, and what that looks like. And so that is my presentation on adoption. Thanks for watching.